Good afternoon. I'm Tamsin Greenwell, urology consultant from University College London Hospital. Sitting on the sofa and asking them about the highlights of their ICS conference today, and in particular the third day. I've got Benoit Peyronnet, who's a consultant urologist from Rennes in France, and I've got Shannon Wallace, who's a consultant urologist from Cleveland. So, can you let me know what you think has been the highlight for you so far, Benoit?
Oh, I go first.
Oui.
Okay. It's like, I'm French, so
Le premier.
the French galanterie would have made me ladies first, but I'm glad. We're far beyond all things. Now we are modern era. So yeah, I would say difficult to pick a few highlights because as always this year's conference is honestly amazing. We had a lot of great time. Among the things that I loved, of course, there was this morning a very good roundtable about how could we bring new pharmacological treatment to be developed for pelvic floor disorders and lower urinary tract symptoms, because it's true that the development over the past few years has slowed down a little bit, but what the speaker nicely emphasized, there was Howard there, Howard Goldman, Laurie Burder, Chris Chappell, and John Issacher. They all really proved that there are still very good targets and pathways that we could tackle and are not tackled and could help our patients. So it's really brings hope, and hopefully we'll have some new pharmacological treatment in the future for our patients.
Yeah, I really enjoyed that session as well. I thought it was really interesting how each of them focused on different areas. So, Laurie spoke about new development in terms of her clinical lab. Howard spoke about the potential of AI, which I think has become a really hot topic, especially we've seen that at this conference, and how that could really advance our field forward. So it was a super excellent discussion, a great way to kick off the day. Although it wasn't the first session, because Benoit had an amazing talk on kind of the future of robotics. And why did you decide that was going to be your talk for this conference?
So to be honest, they invited me to give that talk, so I accepted.
You were voluntold.
Yeah, but I was of course super happy with the topic because that's one of my favorite topics. We often have the opportunity to debate of that with Tamsin, and I think with years she loves it more and more. I think robotic surgery. So
Benoit, I was told that you were really pushing the boundaries on what can be done and can be achieved with the robot. So what do you think is the most avant-garde use for your robot that you described today?
So, if I have to pick, definitely, I've been doing a lot of mesh removal robotically over the past few months and years. And so, to me, robotic surgery has helped me to better remove the mesh, but also better reconstruct. So I think robotic is also an asset for that, obviously with the improved suturing, etc. And also what I was trying to bring up is that this is only the beginning. It will keep evolving, the technology evolves, we have more and more robotic platforms available, so it will hopefully improve the availability for our field to get involved with the robot. But still, I mention it again now, we have quite a lot of work to do, especially in terms of education, to improve the training pathway and stuff, and that's definitely a space where I think ICS will be involved and should be involved because we are all gathered here at this society, and it's going to be better, I think.
And Shannon's too modest, but I went to her early careers session yesterday where Adrian Wagg gave a state-of-the-art lecture on how he established his career and his research portfolio and how he progressed it. And there was a panel of the great and the good, apart from me, talking about how they set up and established themselves in research. And I thought that was such good value and such a nice, friendly atmosphere. So can you talk us through that a little bit?
Yes, sure. So, I'm on the education committee, and one of the tasks that I do is kind of to run the early career session to really get early career professionals involved in ICS. I joined ICS when I first started out. I was a resident and then a fellow. And I just found that this organization has such great mentors and is such a welcoming, warm family. I feel like I've made, international friends for life. And so for me, it was kind of a passion project. I really wanted to, be able to reach as many early career professionals and tell them, like, this is a home for you. You can learn, you can grow. And so every year we kind of come up with a topic. And this year in particular, one of the things that I think early career professionals struggle with is this idea of like research. Like, what do I research? How do I research? How do I start from scratch? And if you're passionate about a particular topic or you're passionate about your field, like urology, urogynecology, bladder outlet obstruction, BPH, all of those things, and you're going to want to research it and help your patients and ask questions. And so the session was really focused on trying to give some pearls and some wisdom to these early career professionals and hearing from experts in the field who have walked those footsteps, right? I mean, Adrian had an amazing keynote speech, but really he spoke about some of the challenges that he had in the beginning, probably the questions that our early career professionals deal with every day. And so that was sort of the aim for the session, was really to spark this idea that ICS can be a place where you can find mentorship and resources and get to know people who have been there before and want to help and guide you.
Fabulous. So have you been to any good workshops?
I just went to your workshop, which was excellent. So speaking of mesh removal, so the workshop 20, which is the one I just went to, is Tamsin's workshop. And there was Howard Goldman, Sandy Vasavada, Brian Linder. And it was, what I really loved about your workshop is that it was so interactive, because the workshop was designed to talk about the complications of mesh slings and pelvic organ prolapse mesh. But the way that you guys did it is you did it through videos. And so there were so many videos, and every video was different. It had a little bit of different surgical technique, but you stood up there and you walked us through, okay, what does this patient have? What's their complication? And then the strategies that you employed while you were doing the surgery. And that was so helpful to see that. I mean, I think most of us, are visual learners. So really to be able to kind of walk through the procedure was excellent. And I think it was also great to hear from the audience. There was a ton of audience participation, a lot of questions being asked, and some variation in the way that you guys operate.
It's really nice as part of the faculty to actually, get that interaction, because we learn as well as teaching. So that's good. What have you enjoyed?
So actually, to your point, Shannon and Tamsin, I think one of the things that I've enjoyed the most again this year, and that I always enjoy the most coming in person also to the conference, are those exchanges. Mm-hmm. So it can be during a workshop, but I had many super interesting conversations with many colleagues from all over the world, like in the area and outside of the actual session. And this is invaluable, like sharing experience and expertise, and how do you do this, how do you do that, how is the follow-up after, and that's, so for instance, I think, and discussing with you just before we started, I will stop closing my fascia lata harvest. That will be a big change for me for now on, because I met several colleagues who have not been closing the fascia lata harvest site for a long time and have a good experience about it. So I will have to fight with my orthopedic surgeon. He wants me to close, but I'm prepared to do it thanks to all of you guys.
You have the support of the ICS members.
Exactly.
Fabulous. And is there anything else you want to mention before we close? You thought it was great?
I thought that, I think the whole past 3 days has been an amazing opportunity to really meet a lot of different people, and I think this ICS-EUS collaboration has been really fantastic. I think Abu Dhabi is such a welcoming, warm place that has allowed sort of people that maybe necessarily wouldn't have come to ICS to come here, to meet us, to kind of meet the people that make this organization as great as it is, and I'm hoping that this collaboration will sort of continue. One of the things I always highlight when people ask about ICS is how multidisciplinary it is, right? And you can see from the program, you have the pelvic floor physical therapy workshops. The workshop I went to yesterday is a collaboration between ICS and the American Colorectal Society.
And there was a great sexual dysfunction after spinal cord injury workshop that does a lot with female sexual dysfunction, was very frank, slightly scary, but...
And so I think just having that multidisciplinary connections and community is really unique to ICS and really unique to this conference. And every time I come here, I'm reminded of that.
And you learn new things and you make new friends. So
that's also a good thing, yeah.
How good can that be? Thank you very much, Benoit. Thank you very much, Shannon.
Thank you,
Thank
Tamsin.
you. Thank you.
All right.